Bring on stress for anyone, especially those dealing with medical conditions like diabetes. With a little planning, diabetics can ease their fears. And joining us now is Dr. Eric Griggs, health educator. Thanks so much for joining us.
Good morning. Thank you.
All right, first of all, talk about how serious diabetes is, and for folks who hear the word but don't really know what it means.
Yeah, diabetes it's on the rise. It's when your body doesn't properly metabolize sugar in your body. It can't absorb it, so it needs a little help with exogenous insulin or with medications. But it's on the rise.
All right, so you're getting out, evacuating. What are some things you need to know? They may need insulin, as you said. Can you travel with insulin without it being refrigerated?
Yes, you can actually. Insulin can be stored for up to a month at room temperature. The problem is you don't want it to be hot. If you're traveling with insulin or oral medications and you're traveling with someone, you want to make sure you have at least a week's worth, an extra supply, and someone else has that same supply.
What if you're not prepared, you don't decide early on that you're going to make the preparations and you're going on a trip, you're diabetic without your insulin?
Without your insulin. So first of all, you want to make sure that you have a note from your doctor, family physician, stating that you have diabetes. You want to carry a bracelet, medical alert bracelet, saying that you have that issue. And then you want to call ahead to the pharmacy, wherever you plan to go, and see if they can accommodate you with generic or the specific brand that you need.
What about snacks and things? Does that at least help the situation a little bit until you can get your medicine?
So you definitely want to, yeah, you definitely want to carry snacks anyway, just in case it takes longer for meal times. Simple sugars like your hard candies, the ones that we tell people to stay away from, they're okay to have in case of an emergency. There's also a glucagon rescue kit that you should have.
Huh. How long before it becomes a true emergency if people don't have the medication they need?
Well, it depends on the nature and the stage of the disease. You typically don't. You can do better with higher blood sugar than you can with low blood sugar. Low blood sugar and low blood pressure lead to states of unconsciousness and all the bad things that you can associate with it.
That glucagon emergency kit that you talked about, is that what we're looking at here?
No, actually, that's the glucometer. Okay. You want to have your glucometer, you want to have extra strip, you want to have an extra battery for your glucometer. And if you can have two of everything, just in case, it'd be best.
All right.
And you also want to make note of different time zones that you're traveling to, because your medicine is time-based.
Huh, interesting. All right, we have a viewer question. Is it bad to sleep on the sofa?
So an occasional nap is okay, but long-term can be bad. It can lead to back problems. It can lead to, because the couch is where we sit, you bring in dirt from inside and outside, it can lead to allergy issues. There's a lot of different things, and typically our couches are in the rooms where the TVs are, and we talked about that before, the damage that blue light and white light can cause when you're trying to sleep.
And you fall asleep with the TV on, and you wake up not rested.
Not rested.